Radiosurgery, or more commonly referred to electrosurgery, is one of the most versatile instruments we have in the dental office. With its variety of waveforms and various cutting tips, we can rapidly remove soft tissue with varying amounts of hemostasis. This rapid tissue removal affords a clear field of visibility and in turn reduces stress of both the doctor and patient. The fully rectified waveform is used to remove soft tissue while establishing hemostasis. This is advantageous when exposing subgingival decay and facilitates bonding procedures. After tooth preparation, the partially rectified waveform can be used to establish coagulation, allowing us to work in a bloodless field. A bendable pencil point shaped number 117 electrode is helpful in controlling bleeding in small interproximal areas. Radiosurgery increases bond strength by preventing blood contamination of the etched tooth structure. It facilitates the placement of a composite by controlling bleeding with increased visibility for the doctor. Radiosurgery, with its micro-smooth, pressureless cut, allows for a stronger, more aesthetic restoration while reducing stress and chair time. This bloodless field can lead to a stress-free placement of a composite restoration. A bendable U-shaped loop number 114 electrode is used with a fully rectified waveform to remove soft tissue and expose any subgingival decay. Irrigation of the surgical site is used to remove any debris. The bendable pencil point number 117 electrode can then be used with a partially rectified waveform to establish coagulation of the soft tissue. The electrode tip can be contoured to help establish better access to the surgical site. Radiosurgery can be effectively used to expose subgingival decay. The radiosurgery waveform can be used around amalgam restorations without any detriment to the pulpal tissue. The fully rectified waveform, which allows us to cut and establish hemostasis, is used with a bendable vari-tip number 118 straight wire electrode. The radiosurgery waveform is used to remove the tissue, fully exposing the amalgam restoration with its recurrent decay. The partially rectified waveform is used with a bendable pencil point number 117 electrode to establish total hemostasis of the soft tissue. This patient reported with a slightly raised papillomatous type lesion and was elected to remove the lesion for a biopsy. A fully rectified filter waveform is utilized to totally excise the lesion without creating any hemostasis or coagulum, and thereby giving the pathologist a clear specimen for diagnosis. A large bendable loop number 129 electrode is used to make the broad incision to totally remove the lesion. Once the lesion is removed, the full duration waveform is used to establish hemostasis and destroy any cyst remnants. After suturing, a postoperative dressing of tincture of benzoin is applied in several layers, with air drying between each layer. Hydrodent, or isobutyl-cyanoacrylate, can be used as an additional postoperative dressing. The healing, as you can see, is totally scar-free. This patient reported with a lesion on her lower lip due to traumatic biting. It was decided to remove the lesion and send the specimen for a biopsy. Radiosurgery was used to remove the specimen and minimize any bleeding. A fully rectified filtered waveform is used since it produces a clean, micro-smooth incision without without any coagulum and therefore facilitates the diagnosis of the specimen. A straight wire bendable Varitip number 118 electrode is used in a pressureless manner to perform our incisions. We can notice a minimal amount of bleeding occurring during the surgical procedure. Once the specimen is removed, a larger bendable loop-shaped number 128 electrode can be used to remove any tissue remnants. This loop can be used with a fully rectified waveform to minimize the amount of bleeding that may be occurring while planing the tissue surfaces. A full duration waveform would then be used to destroy any cyst remnants as well as give us total hemostasis. After suturing of the lesion, a protective dressing consisting of a piece of iodoform gauze and isodent or isobutyl cyanoacrylate can be applied to fully protect the surgical site. The healing 2 weeks post-operative is totally uneventful.